Okay, then good afternoon again. So today we have the session. This is the fourth session, and here we have this is mainly the healthcare policies for the elderly, and these sessions will be chaired by Professor Shivaraju sir, and he's a former professor at the Center for Excellence in CSR at TISS, in an expert in corporate social responsibility, population and development and aging. He has contributed a research on the resettlement, health and development of elderly population in India, and is a key figure in CSR and rehabilitation studies in India. So thank you so much, sir, for agreeing to chair these sessions. Please, sir, please go ahead. Now, session is yours.
Yes, thank you, Professor Dhananjay. And we have the theme of this session is on healthcare policies for the elderly. We have three speakers. And first speaker is Professor T.V. Sekhar from IAPS. His introduction, I think everybody knows. Professor Sekhar's contribution in the field of aging. I think he's one of the senior professors in IAPS. Earlier, he was in Isaac, Bangalore. And he is also now coordinating a Malasi long-term project, and also has published several, he has created several publications, and also regular speaker in various platforms, seminars, conferences. Professor Sekhar is also president of Indian Association of Social Sciences and Health, the organization in which I was also associated. And I'm very happy that Professor Sekhar is going to present on the topic health of elderly in India, emerging challenges. I think Professor Mala Kapoor also joined. She will be the second speaker. I request Professor Sekhar to start his presentation.
Okay. Am I audible?
Yes.
And the PowerPoint is visible?
Yes, absolutely.
Okay, so thank you, Professor Shivaraju, for a very generous introduction. And I am happy to present in this panel on healthcare for the elderly. I think this is one issue where a lot of research and attention is required now, considering the expanding population of India's older adults. As all of you know that by 2050, India will have approximately around 320 million elderly, and taking care of their health insurance, caregiving, long-term care, all that going to be a big challenge for the country, for the households, for the individuals and the families. And so keeping that in mind, I'm going to raise some of the emerging challenges in the health sector for elderly and what can be done to improve the situation. Okay, as you see, there is a greater burden of illness among the elderly compared to other younger age groups that also require greater healthcare needs and healthcare attention. And there is a rapid increase in the chronic diseases like hypertension, diabetes, heart problems, dementia among the elderly. And all of you know the prevalence of non-communicable disease is increasing all over the world. And India is also no exception to that. And we need to have a good idea about the prevalence of these diseases to have appropriate policies and healthcare programs to prevent and control of these NCDs. But in our country, particularly in Indian context, though there are large number of aging studies done by various organizations at various points of time, the health-related data was really missing. And a nationally representative survey to provide the health status of India's elderly was very much required. keeping that in mind and under the initiative of India's Ministry of Health and Family Welfare, Government of India, we launched a major initiative called the Longitudinal Aging Study in India, LASI, and this is a survey which covers both social, economic, health, including the mental health dimensions of India's rapidly growing elderly population. For those who are not familiar with the LASI study, let me take 1 minute to tell you what is about. LASI provides national level estimates. It also provides state level estimates for all the states and union territories of India. In addition, we also have the estimates for 4 metropolitan cities of Mumbai, Delhi, Chennai, and Kolkata. LASI sample includes those aged 45 and above from the selected households. So in the wave 1 of the LASI survey, this is a longitudinal survey. We are going to follow this panel for next 25 years. In the wave 1 survey, when we carried out in 2017 and 18, we covered 73,396 individuals across the country. Out of that, roughly around 32,000 of them are elderly persons, and around 7,000 of them are 75 plus elderly. And so the second wave of LASI, we are going to initiate shortly now. We are almost ready for launching the survey, where we will be going back to the 73,000 individuals we interviewed in the wave 1 and collecting the information about their social, economic, and health conditions and changes over the last few years. Unlike many other health surveys, one great advantage of LASI is that LASI have a wide range of direct health examinations and biomarkers. We are testing the respondents for their blood pressure, pulse rate, lung function test using a spirometry, vision test. We also have a set of anthropometric measurements like height, weight, waist, and hip circumferences. And more importantly, LASI survey also collect blood samples through the dried blood spots, as you can see here in the screen, and testing for anemia among the elderly, the hemoglobin, the diabetes levels, and all other things. And we also have a performance-based markers like grip strength, timed walk, and balance test. So it is not only the self-reported health condition of elderly in India, but also actually measured health conditions of elderly in our country is given by LASI. As you can see, the self-reported prevalence of cardiovascular disease among elderly in India is around 35%. This includes hypertension, heart disease, and stroke. And among the elderly, the hypertension is the major issue. Around 32% of the elderly 60 plus population are suffering with hypertension, and diabetes is also a major concern, around 14% among elderly. This is actually the self-reported by the respondent. But when we took the actual measurement, actual testing on this, the prevalence is much more than that. I will come to that little later. So as you can see, the age-associated rise in the prevalence of chronic health conditions is steady and consistent, and it is more visible for the cardiovascular and lung diseases. As the age advances, the prevalence increases considerably among the population, particularly the elderly population. So the cardiovascular disease, what we call here, is a combination of hypertension, heart disease, and stroke. Those who are suffering from any one of these, all 2 or 3. So overall, the self-reported prevalence of diagnosed cardiovascular disease is around 35% for the elderly in India, and it is increasing with the age as expected. It is higher among elderly women compared to elderly men. So there is a gender divide here. And 50% of elderly residing in urban areas were diagnosed with any one of the cardiovascular diseases. And when we talk about the self-reported prevalence and of hypertension and measured hypertension, there is a big difference. The self-reported hypertension was 32%, but when we tested using the Omron BP monitor when doing the field work, it was around 36%, a 4% difference. This mostly among the poor elderly, mostly from the rural areas. So the self-reported hypertension and measured hypertension is considerably different, particularly in the rural areas and the poorest segments of the elderly population. And when we come to the body mass, the hypertension, we also did some more analysis on this. We found that 42% of them are reported, self-reported hypertension, they are adequately treated for hypertension. Hypertension is under control. But what is more important is nearly a third of elderly are undertreated for hypertension. And more importantly, 1 in 10, around 10% of elderly remain untreated for hypertension. They are aware about hypertension, but they are not taking any medication or treatment. And the untreated hypertension is almost 2 times higher in rural areas compared to the urban areas. The health situation, health conditions of elderly living in the rural area is going to be a major challenge we are going to face. This is about the multi-morbid conditions, elderly with no morbidity. It is showing something around 40%, but those who are having single morbidity is something like around 32% chronic conditions, and all those who are multi-morbid conditions around 24%. So it is not only they are suffering from one chronic disease, sometimes 2 or 3 chronic diseases, which needs a lot of medical care, attention, treatment, hospitalization, and other things. And another dimension which has received very little attention when we talk about nutrition and anemia, we always talk about the young population, women, children. But for the first time, Lassie gives us some idea about the situation among the elderly. 27% of the elderly are underweight, and nearly 22%, a fifth of the elderly are overweight or obese. So we have two problems, dual burden of undernutrition as well as overnutrition. Many are suffering with the underweight, and good number of them, nearly 1/5 of the elderly also have the problem of overweight and obese. And considering the lifestyles and other things, this prevalence level is going to increase considerably in the coming years. The mental health is another issue which has received very little attention in Indian context, and particularly among the elderly. Not many studies looking into the men. Using an internationally recognized measurement scale, we found that around 8% of Indian elderly are suffering from major depression, around 8%, based on the CIDF-SF scale. And you can see there is a considerable difference between the men and women and rural and urban areas. It is more among the women, more in the rural areas, but the overall prevalence is around 8% depression among the elderly. That is another segment which needs a lot of attention in the coming years. So by 2050, even if you go by the 8% depression among elderly, it will be around, by 2050, it will be around 26 million elderly. And another study associated with the Lassie DAD study, it's another study called the Diagnostic Assessment of Dementia. They found the prevalence of dementia is around 7.4% among elderly in India. That means currently around 8 million Indian elderly have dementia now. That is a scenario now. It may be a little alarming, but the number is going to increase next 2 to 3 decades. So we need to be prepared to take on these health challenges. And we also did some analysis based on those who are able to manage their own activities of daily living, like they are able to do their own work, like changing the dress or taking a meal, using the toilet or getting up from the bed. And those who need the assistance or those who have limitations, that number is going to increase considerably in the next 2 to 3 decades. And those who are suffering from disability and impairment, that number is also going to increase considerably in the next 2 to 3 decades. And if you do further, those elderly need a helper or assistant to carry out the basic routine activities like ADL. Their number is from 61 million to around 139, 140 million. Actually, it is from 34 million to around 80 million by 2050. And those who need assistive devices like spectacles, supportive devices, wheelchairs, hearing aids, many other things, that number is also going to increase considerably from 61 million to around 140 million by 2050. So there are many things to be done, and a lot of support and assistance will be required to support them. But we also found that only 18% at the time of the survey, when we did in 2018, only 18% of or approximately 1 out of 5 elderly are covered by any form of health insurance. That is a little big concern. But of course, in the recent years, with the Ayushman Bharat and many other schemes, things have improved considerably. So the healthcare expenditure of chronic illness among elderly in India is a significant concern and contributing to the financial burden of older adults. And most of the health cost is coming from out-of-pocket expenditure. And most of these are chronic diseases which needs long-term treatment and more expenditure. So diabetes, hypertension, dementia, depression, and other chronic diseases may increase the catastrophic health expenditure. There are many studies in India which show that the catastrophic health expenditure pushed many families into the poverty trap because the main income earner is seriously affected by serious illness. The family suffered considerably and they are not able to manage it. So the out-of-pocket expenditures and low coverage of health insurance schemes place a very heavy financial burden on elderly and their families. So what are the implications? I have given you the data of the health conditions, health status of elderly. What are its implications in the coming years? You know that population aging is inevitable. It is going to happen. The number is going to increase much rapidly. But how far we are prepared to deal with the expanding and evolving healthcare needs of our older adults? That is a big question. The governments have the major responsibility of providing the economic security, social well-being, geriatric healthcare services. You will see more and more geriatric wards in our hospitals in the future years and long-term care. And as we have seen, there is a significant prevalence of undiagnosed and underdiagnosed diseases, more of hypertension, diabetes, and vision impairment. That is going to be a big issue. And so the economic vulnerability of older population, considering that we need to design the health programs, long-term care, and other old age programs. And there are some sections among the elderly more vulnerable, particularly neglected geriatric population, particularly among the elderly widows, may need more attention. Government of India's Health Ministry have a program called the National Program for Healthcare of Elderly, which has many programs implemented. There are regional geriatric centers, some geriatric hospitals. Now government also have a health and wellness centers recently renamed as Ayushman Arogya Mandir, where the elderly can take some help and healthcare. And most importantly, last week, Government of India came out with a major announcement. That is, all elderly, 70 plus elderly, are going to be covered under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana health insurance cover. This is a major step by Government of India, which will benefit nearly 6 crore senior citizens of our country once it is implemented. All the 70 plus elderly coming under the Ayushman Bharat health insurance program. So we need a lot of policies and programs which also need significant resources, coordination, and commitment across sectors and stakeholders. Because the government health sector alone cannot do this. There is a lot of involvement of private health sector, voluntary health sector in this. And if you are able to invest these resources properly at this right time, we are sure this is an investment for a future, more a healthier population, more an happier population, and a socially secure older population in our country. And of course, we know that life expectancy is increasing considerably. The current generation will live more years than the previous generation, and the life expectancy is showing all that direction. So the extended years of life of our elderly can be healthier and happier. And if you are not able to take care of their health conditions now, the extended years can be of years of suffering with the chronic diseases, disabilities, and impairments. So there are a lot of challenges for the health sector, particularly to take care of the elderly in the coming years. I will stop here. I think we will have some time for discussion later. Thank you very much.
Thank you, Professor Sekhar, for your excellent presentation on health of elderly in India based on the data that is from LASI Wave 1. I think you have very much in a user-friendly way the major findings, and you have crunched that data and presented very comprehensively, at the same time very focused way, starting from self-reported and also touching upon the information that comes out from biomarkers, which is first time such a large-scale survey has covered, starting from blood pressure or anthropometric measurements, so many important wealth of data that has come out, including the underweight, overweight, mental health issues. So they are all, very rich information, which is also very alarming, especially when we are seeing the data that more female elderly are going to suffer, furthermore rural. So some of these challenges which is going to come while addressing the issues for healthcare of the elderly, I think you are right, very aptly presented the data plus your implications that you have highlighted and provided are very important for program point of view, for policy point of view, what lessons which we have to draw and programs that we have to implement. I think I'm sure there will be several other clarifications that our participants may require. We will take it up after 3 presentations. Thank you, Professor Sekhar.